The morning began quietly at the community health clinic. Nurse Emily had just finished preparing her treatment room when her next patient, Michael, arrived. His physician had prescribed an intramuscular medication to help manage his condition, and today he was scheduled to receive the injection. Michael looked slightly nervous as he entered the room. "I've never had an IM injection before," he admitted. Emily smiled warmly. "That's completely normal. I'll explain everything and make sure you're comfortable throughout the visit." Before starting, Emily carefully verified Michael's identity, reviewed the physician's prescription, checked the medication label, and confirmed that all safety checks had been completed. She washed her hands thoroughly and organized the necessary medical supplies on a clean tray. While preparing, she continued talking with Michael to help him relax. "So, what do you do for work?" she asked. "I'm a school teacher," Michael replied. "I spend most of my day answering questions." Emily laughed. "Well, today you get to ask the questions." The friendly conversation eased Michael's anxiety. Emily explained that intramuscular injections are used when medication needs to be absorbed into muscle tissue. She also described that healthcare professionals carefully choose the injection site based on the patient's age, body type, prescribed medication, and clinical guidelines. Once everything was ready, Emily helped Michael into a comfortable position while maintaining his privacy and dignity. She reassured him before beginning the procedure. "Take a slow, deep breath," she said calmly. Michael followed her instructions and relaxed. With confidence developed through years of clinical experience and professional training, Emily administered the prescribed intramuscular injection using proper medical technique and sterile practices. Throughout the procedure, she communicated clearly and ensured Michael remained comfortable. "It'll be over before you know it," she said. Only a few moments later, the injection was complete. Michael looked surprised. "That's all?" Emily smiled. "Yes. Many people expect it to be much worse than it actually is." After the injection, Emily safely disposed of the used medical equipment in the appropriate sharps container and documented the medication administration in Michael's medical record. She observed him briefly to ensure he felt well before leaving the clinic. "I honestly worried for nothing," Michael admitted. "That's very common," Emily replied. "Understanding the process often helps reduce fear." Before he left, Emily reminded him to follow the advice provided by his healthcare team and to contact the clinic if he experienced any unusual symptoms or had concerns about his treatment. Michael thanked her sincerely. "You made the experience much easier than I expected." Emily smiled. "My goal is always to provide safe, professional, and compassionate care." As Michael walked